In this video, I will describe the premise of this UN submission, including why there is a clear line of US federal government responsibility for the DC people's right to health. Now, a person's health is shaped less by healthcare or lifestyle choice, and more by the social determinants of health. That is, the conditions in which we're born into, that we live and work within. These are things like housing, education, and discrimination. These broader systemic systems are important influences on health inequities. The COVID pandemic has laid bare the significant disparities in America, and Washington, DC has some of the most extreme examples of this. A COVID death rate 6 times higher for Black versus white DC residents, despite having a fairly equal infection rate. I won't go into too much detail of the health disparities in Washington, DC, the facts of which are detailed in our concept note. But it's clear from our initial assessment that over numerous decades, the US government has repeatedly violated the rights of DC residents. Specifically, Congress has frequently used its power over DC to challenge or even abolish important life-saving public health programs, including those related to reproductive health, clean needle exchange aimed at reducing the spread of HIV/AIDS, and the implementation of the Affordable Health Care Act. And most recently with COVID-19, where the funding was delayed and far smaller than it should have been due to the way DC is treated as a less than equal place in the United States of America. All of this has contributed significantly to DC having some of the worst health outcomes in the US and some of the largest race-based disparities. For instance, DC has the highest HIV rate in the country and some of the worst maternal and child health outcomes. In the poorest wards, infant mortality rates are at levels of countries such as Cambodia and El Salvador. But it's the inequity within such a small geographic area that is striking. For example, infants in Ward 8, predominantly Black, are 6 times more likely to die than infants in Ward 3, predominantly white. We've prepared the facts concerning the current state of health disparities in DC. We have prepared an analysis of international law on the right to health in the context of discrimination and equality, with a particular focus on minorities and women and girls. And with that, we will analyze domestic frames and avenues to redress health disparities in Washington, DC. In the next video, I will describe why that matters to the UN and how we can use that to pressure the US federal government to act.